Well, when the tide goes out, you discover all sorts of unpleasant things lurking beneath the surface. We already knew that the well-being of the medical profession was not great. We'd already had the GMC surveys that showed the unsupported nature of the experience of junior doctors. We then had the trainer survey saying that the senior doctors had exactly the same difficulties in terms of um, uh, support for practical aspects of their job, but also a lack of um, voice sometimes in how services should be planned and delivered, which was quite different to how hospital medicine functioned 20 years ago. Uh, I think that the difference between Scotland and England is that we didn't have a practitioner health service. And at an early point, it was identified that the well-being of staff would be a major issue. So my colleague Dave Caesar was appointed as a national well-being person in Scotland, and he's now a deputy chief medical officer. Now, whether that's enough or not, I simply don't know. As a health professional in Scotland, I can go to a website where I can get online resources, and there's investment in a special health service for health and social care staff. But more fundamentally, however, I think there needs to be a renegotiation with members of the medical profession, particularly in their hospital work, so that um, that they're more supported in what they do. There's almost been something like an inverse wish not to support medical staff, to create a non-egalitarian a workplace. But um, one of the nicest things that happened um, in the middle stage of COVID was unemployed air hostesses came in and set up these pop-up lounges, and it wasn't anything special. It was an urn of coffee and crisps and socially distanced space in which to meet people and just take some time out, and that was fantastic. And it made me remember that lots of the things that we used to take for granted had been taken away. So, for example, we had um, um, a sort of lounge facilities for staff, which were taken away. We had educational facilities and a library, which were closed, and these performed an important function in in well-being generally. And I think we're having to rediscover them. I was interested today to get an email because they're setting up a library again within the hospital that I work. Why anybody thought that we could do without a library, I don't know. I think the error came about thinking about the function of the space, and it was a place where people could come together and also take themselves away from a different work environment to a study environment. And having gone through COVID, having re-examined the importance of space and meeting, I think we'll see a return both to staff relaxation areas and also to staff educational areas.